Hi, my name's Noelle. I'm an LVAD coordinator here at CPMC. Today I'm going to be demonstrating an LVAD dressing change. This dressing is done daily. Let's get started. Okay, let's talk about the supplies that we'll need to carry out the dressing change. You'll need a total of 4 clean gloves, a gauze that's 2x2, a drain sponge, which is a sterile dressing with a slit down the middle of it, 3 chlorhexidine swabs, and some cloth or paper tape, as well as a Foley Anchor, which is a device to help secure the driveline. Supplies may vary depending on your insurance. You may be provided a chlorhexidine wand instead of a swab. Please remember to change your dressing after you shower and allow for sufficient time for the site to dry completely before you dress it. Now it's time to begin cleaning. First, you will wash your hands really well and put on a brand new pair of gloves. When removing the old dressing, it's a good practice to use adhesive remover around the borders of the dressing to loosen it up. You can lift a corner and rub a little of the adhesive remover around it. Avoid pulling the dressing off too quickly because you could accidentally pull the line. Pulling the line could cause trauma to the site and could be a portal of entry for germs to enter and infection to begin. And gently pull away. Once you've taken down the old dressing, this is your chance to do your assessment. You'll want to take a look at the site and ask yourself, is the area red? Is it swollen? Is there any yellow or green drainage? How much? Is there any blood or dried blood? Is there pain or discomfort? And is the area warm to the touch? These could be signs or symptoms of an infection, and we want you to report those to your nurse coordinator or doctor right away. To begin the cleaning portion, you'll want to clean your hands. And put on a new set of gloves to clean. First, you'll remove the swab from the package. To activate the swab, there's fluid here at the base. You're going to squeeze the 2 arms together until you hear it crack. You'll invert and allow the fluid to run down and fill the sponge. Now you're ready to clean. You'll take your swabs, a total of 3. And a good practice when you're thinking about cleaning is to think of the site like a face of a clock. You start at 12 midnight, really tight, close to the line, and you'll scrub all the way around, hopping over the line. And when you get back up to the top of the clock, you stop. You'll only take that swab around 1 time, and you can dispose. You'll move on to your next one. This time, like the rings of a tree, you're going to move out a little bit further. You're going to scrub all the way around. And when you get to the top again, you stop. And this swab is done. The 3rd time around, you'll move out even further, scrubbing around. Making sure you're covering all the area. Allow the site to air dry. Initially, 6 weeks out of surgery, there's going to be 2 supportive sutures here, about right here. So you won't be able to get too far under the line with your swabs, and that's okay. We don't want you to force it. Just do the best you can, and after 6 weeks, you'll be able to clean under that line much better. To dress it, you're going to take a new drain sponge and place it right on top. After 6 weeks, when the sutures are removed, you'll be able to slide that drain sponge underneath, but initially it's okay to lay it on top. And you'll also add a 2x2 sterile gauze. You'll take your cloth tape and lay it over the site stretching. You make sure you have a good seal with the tape. Pulling over the line and running your hand over the border several times. You can also pitch the line right here to make sure you keep out all the germs. And last but not least, the Foley Anchor. It helps to secure the drive line and protect from accidental pulling of the line. It should be worn all the time and can last up to 1 week. You'll take the Foley Anchor out. We want you to do arrow down. And you're going to find a place along the line, not giving it too much slack. One wing at a time. Making good contact with the skin. And the same on the other. All right, you're going to take the 2 wings, stretch them so that you can see the hole. So take one piece, dive it underneath the other, and pull all the way through until you can see the flap on both sides. So I hope you found this video helpful. Over time, with practice, this will become second nature, but we're always here to help. Don't hesitate to reach out to call your coordinator or doctor with any questions. Take care.